Most commonly, when you feel like you have a depression or an anxiety or an addiction or whatever else, what you'll do is you'll identify a practitioner of some kind. You'll go to their office. They'll ask you a series of questions designed to bring out what sort of symptoms you're struggling with. After getting a list of those symptoms, they'll identify a particular kind of diagnosis that has been established with that cluster of symptoms. And then they'll identify a treatment that has been demonstrated to be effective with that particular cluster of symptoms. I call that approach symptom-centered treatment. And there's certainly some good things about that. It's helpful to know the name of what's wrong with you. But I've also noticed some specific downsides of that particular way of dealing with emotional problems. The first problem, of course, is simply side effects. Almost every treatment that's designed to address a certain set of symptoms, in the process of trying to relieve one set of symptoms, almost inevitably brings up another set of symptoms. This is certainly the case with medication. There's no such thing as a medication that doesn't have any side effects. And what my clients have often found, as they've gone from one medication to another, to another, to another, is that the side effects can be just as troubling, or sometimes even more troubling, than whatever was bothersome to them in the first place. And so sometimes they'll perhaps start with a mild depression, and so they'll be treated for that. And then in the process of dealing with the depression, then now they have a sleep problem. And so then they get a medication for the sleep problem. In the process of that, it'll launch an anxiety disorder or whatever. And so that's one of the downsides of symptom-centered treatment, that again, in trying to address one set of symptoms, others get created. Similarly, in dealing with counseling approaches, there can be side effects to some of those. The most common side effect I've seen of some kind of counseling approaches is that in the effort to try to identify where a certain distress or malady comes from, often counseling approaches will identify some element or person in the person's past whose behavior, mistakes, whatever, seem to be at the foundation of the person's current pain. That side effect I've seen be significant enough to destroy whole families, to destroy relationships that are important to that individual, and to create even more a sense of resentment, a sense of hopelessness, a sense of, if even the people I love hurt me so much, then, what's the point? And so both medical and non-medical approaches, when addressing the symptom is the major focus, sometimes the side effects, again, the cure can be worse than the original malady. So that's one problem I've seen with symptom-centered treatment specifically. Another problem that I've seen is that of diminishing effects. Sometime a medication or an approach will work for a while to reduce a symptom, but there may be another element of that person's distress that can be not helped by that particular treatment, and so that element of the distress sometimes grows and becomes more severe in the process of trying so specifically to target this particular symptom while this one goes unaddressed. And so for that reason, and simply for reasons with medication of, chemically the person becoming less and less sensitive to the impact of the medication, sometimes what seemed to work in the beginning seems to get less and less and less effective. And then certainly there's the problem with withdrawal effects. Particularly with strong chemicals, when you take something away, the body has gotten used, and the brain has gotten used to the presence of that chemical, and often doesn't respond very kindly to that chemical being gone. So a lot of times, what I've seen with clients, particularly with medication, is they go on a medication hoping to relieve those symptoms. Maybe it relieves those symptoms for a while, maybe not. Maybe they, as I said, develop new side effects, experiencing those diminishing effects, and finally feel well enough or frustrated enough to go off the medication, and then often get hit with a whole new wave of withdrawal effects that, again, creates just as much or sometimes even more distress than they started with in the first place. And again, similarly with those kinds of counseling approaches that are designed so much to target one thing that they miss a whole bunch of other things. A second problem with symptom-centered treatment tends to be piecemeal relief. In other words, even if a treatment is successful in relieving a certain piece of the problem, a certain set of symptoms, more often than not, emotional problems and more emotional challenges are the result of a number of different factors, only one or several of which get addressed by a very targeted symptom-centered approach. And so while there may be some improvement in this area, these others don't get addressed. It isn't a healing of the whole system, it's a relief of these particular symptoms in this subset of the person's experience. Frequently, it creates a certain amount of dependency on the treatment provider. I can only feel good as long as I take my medication, or as long as I continue to go see this counselor, or as long as I continue to see my energy healer, or whatever it might be. The healing within the person isn't necessarily activated. It's that their symptoms are less severe as long as that treatment is being applied. But that treatment being applied, of course, relies on continuing financial investment and continuing investment of time and effort to continue that particular treatment in order to be successful in relieving those symptoms. All of that is very different than a view of actually healing the individual themselves from the inside out. People so often come to my office concerned that their decades-old depression, that their generations-old pattern of addiction or anxiety or anger or whatever it is are kind of set in stone, that they're genetically programmed, that they're environmentally programmed, that things can never get any better. Well, by the laws of the natural world, that's probably true. But the beautiful thing about turning in the midst of these problems to the Creator of the universe is that the limits of the natural world are superseded by a higher law, because He can create a new kind of creature. He can create a new kind of family, a new kind of civilization. That's the promise.